What is delayed ejaculation? My name is Martha. I'm a clinical sexologist with a doctorate in human sexuality, and I'm from Eros Coaching. In this video, I will explain more about delayed ejaculation. Delayed ejaculation refers to a condition that happens when a man would like to ejaculate, but however is ejaculating later than he would like. This is the reverse of premature ejaculation, when a man is ejaculating sooner than he would like. This also refers to when a man would like to ejaculate but is unable to ejaculate for whatever reason. It could be physical, it could be psychological. Physical, for instance, the man has gone through prostate surgery, has prostate enlargement that is happening, which is inhibiting his ability to ejaculate. There could be other physical reasons, such as urinary incontinence, such as urinary tract infection, that might lead to other kinds of complications relating to his body. When we're talking about psychological issues, it could include things like anxiety. Even the desire not to impregnate his partner may also result in delayed ejaculation. Delayed ejaculation is linked to erectile difficulties or erectile dysfunction. What this means is that, for instance, the man wants to ejaculate but is unable to ejaculate and is taking much longer than he would like, and he's starting to get anxious. Maybe he's not anxious, maybe he's just getting tired, and so he starts losing his erection. Sex can be tiring when you are having prolonged penetration or thrusting for a time. And so we get tired, and therefore leading to the loss of his erection. This does not mean that the problem is erectile difficulties. It means that his problem is actually with the ejaculation. So a lot of people confuse the two as if they're the same. Therefore, it's very important for me as a sexologist to ask accurate questions so as to get a better picture of what is going on. Just like what I mentioned in the erectile difficulties video, we like to separate all difficulties into physical and psychological. However, there's another type of client that I'm seeing which are having difficulties with ejaculating because of what I call desensitized penises. Desensitized penises are a result of masturbating perpetually over a long period of time in ways that are quite hard. We tend to masturbate, men and women, quietly, quickly, secretly. And we tend to do this because we are afraid if we take too long to masturbate, for people with penises to ejaculate, if it takes too long to ejaculate, we might lose our erection. And not only that, we might lose this repetitive motion. We might start getting tired in our arms. And so we rather do it quickly so that we can get on with our lives, so that perhaps we can sleep. Masturbation is sometimes used as a way to self-soothe. It's also used as a way to start our day. However, most of the time, we treat masturbation as the way to get things over and done with. And therefore, the way we masturbate, because we know our body, we tend to masturbate quietly, quickly, secretly. We tend to masturbate more and more quickly, more and more harder over time. And I see this with my clients. I don't see it, but I hear from them that they tell me how, when I ask them how long they take to ejaculate, to masturbate to ejaculation, and they would tell me the time duration. And they're not really focusing on the sensation of pleasure. It's more a way to get things over and done with. So because it's kind of just a routine, they're just going through the motions of it. They tend to be quite hard on their penis. So one of the things that I do see with some of my clients when I ask them more questions is that they actually have desensitized penis, which means their penis is not as sensitive as it used to be. And they may be having penetration, and the friction is not enough for them to ejaculate, because the friction when they're masturbating on their penis and when they're having penetration is very different. So when it's very different, their body is not able to get enough friction or enough of a grip for them to ejaculate. So sometimes I hear clients saying things like, it's almost as if I wish this person was tighter. And this is a telltale sign of when the penis has lost a lot of sensation without his realization. When men read about such things or hear about such things, they start to really freak out. I want to reassure you that just because you have a desensitized penis, it doesn't mean that it cannot become resensitized. Resensitization takes time. And it is not about abstaining from masturbation. It's not about stopping and then hoping that somehow there will be a cure. There's a lot of inaccurate information on the internet. Resensitization of a penis means being really gradual and gentle with massaging your penis. It means really focusing on sensation. It means being gentle with yourself. It means returning and noticing pleasure in your body. What a lot of men tend to do is they masturbate to porn and they're not really engaged with the joy of sensation in their bodies. They're not necessarily enjoying masturbation. It's just a release. It's not pleasure. So it's very important to change the dialogue around masturbation and to support them. I support them in letting them know what they can do to overcome this issue of delayed ejaculation. So what happens with my Ready Get Sex Go training program is it helps men to overcome premature ejaculation. But what a lot of people don't know is that the same techniques also help men to resensitize their penis, because through the massage, through the resensitization of penis, it becomes more sensitive. Whereas for those people with sensitive penises, by massaging their penis actually becomes less sensitive. And it is very important to do it in a proper way and to have some patience, discipline, and as anything, it's a practice, therefore it does take some time. So if you're interested to find out more about overcoming delayed ejaculation, you can reach out to me. I do Skype coaching, and you can reach out to me at drmarthalee@eroscoaching.com. So that's the email for clients who would like to work with me. And for people who would like to ask me questions to make another video, you can email me at ask@eroscoaching.com. Doesn't matter. All the emails go to me, and I'll check everything anyway. So you may want to understand, I hope you get a better idea now of delayed ejaculation, and not only that, an idea of what the treatment method is, which is exactly the same as my premature ejaculation training program. That program is tailored, the languaging is around premature ejaculation, but the same treatment helps men with delayed ejaculation. That it's not going to help men so much if there's a physical cause. For instance, like I mentioned, they've had surgery, they've removed their prostate, they're having prostate enlargement. This is a physical issue. There is some work that needs to be done for men who have psychological anxiety. However, I'm seeing a lot of clients with delayed ejaculation who actually have what I just mentioned is desensitized penis. So if you are understanding what I'm saying, and if you feel that you need support, you may have some other questions, feel free to reach out to me. This is Martha of Eros Coaching.